Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. As you can see, I'm in a real precarious position here, but yet I'm not nervous. I'm in a dental chair with Dr. Susan Creech, who's been on some podcasts with me before. Very knowledgeable, very informative. So we decided to do one today on oral cancers. Seems like I'm seeing more in my office just incidentally. And you mentioned to me a good point. You asked me, does anybody ever come into your office for one thing and you find something different that they really need to address, probably even more importantly, every day? So you find something similar because you look for everything. I mean, if you've seen her podcast with me before, we talk about oral bacterial screenings for different kinds of yeast bacteria in your mouth. She's a preventative, forward-thinking dentist, there's no doubt. I just found out she had reverse osmosis throughout her whole office, but she's really progressive. And this thing you're doing with testing salivary for all this stuff is just amazing to me. I've sent you many patients that are very thankful, and you're very proactive with this thing because poor dental health equals poor heart health,
Exactly.
as you know. But tell me, you even have some new stuff for this testing, but let's talk about oral cancer. Do you see some of that when they come in for cleanings and things?
So we do. We see oral cancer from time to time. Every patient that has a cleaning in the office, they are getting an oral cancer screening. Every time it's a visual screening, and I do offer a supplemental exam as well to do an oral cancer screening using this right here, which I'm going to do on you in a few minutes.
Wonderful.
And it's called Vizilite. And Vizilite is a supplemental screening tool that will help light up the mouth, and it uses biofluorescence, and it has these 5 LED lights in it, and anything that's dark in the mouth is something you just need to take a good look at. Look at the margins of the lesion that you're seeing, look at where it's located, ask the patient if they've ever had any trauma in that area. Because that could be potentially an abnormal area. Anything that's healthy, normal, is going to light up and be very bright. It's the dark areas that you're looking for with this particular test. This will allow you to see certain lesions before you can actually see it with your eyes in just a visual exam. So that's why I think it is so important to add this supplemental test to the oral cancer screening so that we can be on top of it and not miss anything. Because with oral cancer, the earlier it's found and treated, the more likely that it's going to be cured.
I've never seen that or heard of it. Now, is that something similar to what the dermatologist may use?
And when I'm explaining to my patients and telling them what it is, like if you've ever been to the dermatologist and they use that little round light that they put up on your arm or leg to look at something, it's a very similar concept.
That is awesome. I just can't wait to get this done because I have had some problems in my mouth with a couple lesions. Turned out to be nothing serious. I actually had a biopsy of my tongue because when I had COVID 4 years ago, it really affected my digestive system, and your mouth is the first part of that. So it wasn't leukoplakia or anything dangerous. But it's interesting. I can't wait to. That is amazing. I didn't know you did this.
Yes. Yeah,
with that light.
And we try to tell every patient that's in the practice that we offer it and see if that is something that they're interested in doing. So a lot of patients.
Definitely interested.
And I recommend doing it annually.
So you do see a suspicious area in there, and you want to follow it. You take a picture of it?
I do. So, in my system back here, I have their chart pulled up, and I have an area where I can hook up a camera, and I'll take a picture of the lesion. We'll date it, and then, it's marked, so the next time they come in, or oftentimes I'll say, let's see you back in 2 weeks or a month, just to check it. And if it's still there, and if it's still there, then we're not going to ignore it. We're not going to say, let's watch it. I'm going to go ahead at that point, talk to the patient, see if they want to be referred to a specialist that will do biopsies. and go from there with it.
That is an amazing tool. I'm very impressed with this.
Yeah.
Believe me, you're going to get a lot of business from this.
Well, we're definitely
From me.
seeing more. Well, thank you. I do appreciate that. And we're seeing more oral cancer for a couple of different reasons. There are risk factors or risky behaviors that can contribute to oral cancer. So, of course, everybody knows that smoking, using tobacco is a cause of oral cancer. Many people don't know that the HPV virus, which is transmitted through bodily fluids, especially HPV 16 and 18, which is covered in the vaccine, correct? And that, HPV virus can cause oral cancer mainly in like the esophageal throat area.
That's usually the cause of it.
Yeah.
HPV, human papillomavirus.
Right.
You think papilloma, you think warts.
Right.
And it typically is. And that's what they're screening for cervical cancer with pap smears in general. But
and then heavy alcohol use as well is increased factor for oral cancer.
you think poor diets are as well, or?
I think that diet can be linked to many of the issues and the abnormalities in our body.
What about sugar, if you just swish around sugar in your mouth all day?
Well, and we'll talk about cavities in a little bit, because in our salivary testing, we're definitely looking for that too. So I think sugar plays a role, as I've seen in literature, with cancer and obviously with cavities.
Speaking of cavities, have you found mercury fillings maybe associated with more of these oral lesions or other problems, or if at all?
Well, sometimes with mercury fillings or amalgam fillings is what we call them, you will find occasionally some irritation from the roughness of the filling over time. And, and just the opening of where the filling meets the tooth, you'll have an opening or a hole, and you'll see a cavity around an area like that.
Nobody really does those much anymore, do they?
I don't think so. No, I don't.
Because I have a lot of my patients that get rid of them. They're convinced that they have mercury toxicity and they get rid of them.
Yeah, and there's big debates on that. There's some states that have banned silver fillings, but there probably are some people still. And like I think in one of our podcasts, I told you that when I graduated from dental school, which was in 2004, we were still doing amalgam fillings on our board examinations, and that was 21 years ago.
So fairly recently, yeah.
I think so.
Yeah, very recently. You're still young.
Yeah.
You're in the height of your career. You're doing all this innovative stuff that's really impressive. You're not just doing the same thing you learned in dental school.
Right.
You're really asking why. Why do they have this? And you're screening.
Yeah.
Because if you can prevent something, it's way better than treating it.
Absolutely.
But,
and in 2022, there were 55,000 oral cancer diagnoses made in the United States. There were 12,000 people that died from oral cancer because it's really undiagnosed.
Yeah.
And once it's too late, where the patient has a large hole in their mouth from where the cancer is located, oftentimes it can't be.
And a lot of times
treated.
It's asymptomatic too, isn't it? You see a white spot in there, leukoplakia, which I think is precancerous.
Yes.
So it needs to be biopsied.
Right.
Well, I can't wait to see how.
Are you ready to do it?
I'm ready.
Okay. All right. I'm going to lean your chair on back. And so first of all, I'm going to be looking visually, just at what does the tissue look like. And I'll go ahead and have you put these glasses on because the light that I will use is quite bright. Okay, so I'm going to be looking just all around the mouth as I would on any examination, looking up under the tongue on both sides, and then I'll ask you to stick your tongue out. And I'll hold the end of the tongue and look on the side of the tongue. Okay, and then I will ask you to say ah.
Ah.
That helps to push the tongue down in the back so I can see more down the throat. And then I'm going to pick up my instrument, Vizilite, turn it on, and this light is an LED light. And just looking for any area that is dark. So I have a document that I use in every patient's chart, and it has different locations in the mouth, such as the hard and soft palate, the tissue. I even look at the lower lips and the upper lips. I'm looking at salivary glands. And stick your tongue out, please. Again, the top of the tongue, the side of the tongue, and under the tongue. And I'm documenting each of those areas to my dental hygienist or dental assistant, and they're marking, you know, that they're checking off that I've covered every area. So you can see it's a painless and relatively quick examination. Okay.
That was easy.
Yeah. No pain.
No, not at all.
The light may have felt quite warm.
You could tell it worked because it's a little warm, but you could tell it's amazing.
So early on in my dental career, I was working in Memphis, Tennessee, and I had my first oral cancer diagnosis, and it was a patient that had a denture, and underneath her denture she had squamous cell carcinoma.
You think the rubbing might have caused it?
It could have, or the patient didn't take her denture out, and so she never saw that there was an actual lesion on the roof of her mouth, is what my guess would be.
Interesting, interesting.
Yeah.
Do you find, I'm a big proponent of red light therapy. Do you think that, because I do it on my whole body, red light, and I do my infrared sauna, do you think red light may be preventative for oral? I know they used it to whiten teeth sometimes, don't they?
The red light therapy for teeth is a different type of light.
Okay.
For whitening.
And you have to combine it with other things.
You have to combine it with actually a whitening gel.
Okay. Okay.
I don't know about red light therapy. I've never seen that as a treatment for oral cancer. You would really have to have a light that would.
Yeah. I wasn't saying
all-
treatment really for more of a preventative.
Okay.
Because it's supposed to promote healthy tissue is, what I'm thinking. But that's something we can talk about, red light therapy for in your mouth.
Yeah. I'll have to do some research on that.
Yeah.
I haven't come across that at all. And
so oral cancer, that is a very good screen for oral cancer. I've never had one that thorough by far, so I'm impressed with that. So every patient that comes in here, you're going to screen them.
Yes, I'm always going to do a visual examination, and then if the patient would like to have a supplemental, then that is an additional procedure that is done in the office. It costs about $120 to do.
Well worth it.
And most insurance companies are not going to offer any coverage for the supplemental examination, but 2 to 3 minutes of a very thorough examination that could save your life.
That's
really
well worth it. I know I'm going to do it every year from here on out, for sure, especially with the problems I had in my mouth before. But anyway, Dr. Susan Creech, that was wonderful. Thank you so much. We're going to do some more podcasts with you through the year, and so you can keep us up on all these changes. Take care of your mouth, because if you've got a terrible mouth, or you've got bacteria in there that shouldn't be there, yeast, all that stuff, you're going to have problems. So get good oral screenings, and your heart will be good, and you'll feel more energized. Everything relates. So thank you so much.
Yeah. Thank you for having me.
Letting us come out today, and we'll see you next time.
All right. Thanks.